For shoulder ultrasound, we're going to use the high-frequency linear probe shown here.
To obtain the anterior view of the shoulder, we're going to place the probe in a short axis view relative to the humerus, with the probe indicator pointing to the right. The probe is placed in the extreme proximal location of the humerus, and you may have to slide a little bit down the arm or up the arm to get the tuberosity and bicipital groove into view. Now we have that. You can see the lesser tuberosity here, the greater tuberosity here, and the bicipital groove in between right here. In the bicipital groove, you can see the long head of the biceps tendon, and you can follow that down the arm to the musculotendinous junction here. As we slide back up the arm, back to the bicipital groove, you can see the subscapularis muscle just come into view with the subscapularis muscle tendon here. You can have the subject externally rotate his shoulder, and you'll see the subscapularis muscle come into view here. Overlying that is the anterior portion of the deltoid muscle. We can track the motion of the subscapularis muscle and tendon as the subject externally rotates and internally rotates the shoulder. To apply the superior view of the shoulder, is best to position the patient with their hand on their hip. The probe indicator is pointing to the patient's right, and the probe face is applied to the superior aspect of the shoulder. Once you're in the right position, you'll see the acromion process here. We can see the humeral head here. Just deep to the deltoid, we can see the muscle belly of the supraspinatus muscle. And as we follow that out, you can see the supraspinatus tendon attaching on to the greater tuberosity, which is positioned here. As the subject abducts his shoulder, we can see the supraspinatus muscle and tendon recede underneath the acromion process. And then as he adducts his shoulder, we can see the muscle belly come back into view. And you'll notice that the muscle and tendon slide smoothly underneath the acromion.